Hello and welcome to my simulation talk that addresses the integration of advanced practice nursing and interprofessional education from a very unique perspective. My name is Jill Buterbaugh and I'm a family nurse practitioner as well as an assistant professor of nursing at Frostburg State University, where there are two new and exciting advanced nursing programs beginning. Well, the programs just began this week and no simulations have been executed to date. I was involved in an inaugural telemedicine program, which in combination with the simulation training that I received from the Maryland Clinical Simulation Resource Consortium, I was able to develop a simulation experience that is unique and applicable to real-life practice as an advanced practice nurse. The purpose of this talk is to describe to you the steps necessary to develop a unique simulation experience using telemedicine and incorporating interprofessional education. This is actually a two-simulation scenario with the focus to develop communication skills and the ability to perform interdisciplinary telemedicine consultations for advanced practice nurses. Frostburg State University has developed and implemented an advanced practice nursing program with concentrations in psychiatric mental health and family practice. We are targeting experienced nurses in underserved areas with the intent to educate and train these nurses to become independent practitioners that are able to address the healthcare provider shortages in Maryland, particularly focusing on the rural areas where they are most needed. Our university is rurally located, as are most of our students. This program was developed using a blended model where the majority of the time students will be working from home. But we firmly believe that there are just some things that cannot be taught online, so students will travel to the university for intensive, purposeful educational experiences. We face the challenges of being a rural-based program where the students are not physically present on campus often, and there are no other graduate level programs within our university such as physical therapy, pharmacy, social work, or medicine upon which we can rely to integrate interdisciplinary education. On our campus, the intensive experiences will rely heavily on simulation based upon the International Nursing Association for Clinical Simulation and Learning Standards. The current literature on advanced practice simulation focuses on acute care experiences, generally in a hospital-based setting. That's not what I needed. For my family nurse practitioner program, for which I'm the coordinator, I was unsuccessful in locating any standardized simulation scenarios that were family practice based in a primary care setting. This completed Criterion 1 of the UNESCO Standards of Simulation Design, the needs assessment. I really needed more office-based scenarios. I strongly felt my first step in this new endeavor was to educate myself. I spent many hours taking courses on simulation training, not only through the wonderful Maryland Clinical Simulation Resource Consortium, but through the University of Maryland, Johns Hopkins University, George Washington University, and the National League of Nursing. So after almost 80 hours of continuing education credits focusing on simulation, I felt I had the foundation that would allow me to create a meaningful and purposeful scenario to integrate interdisciplinary professional education into my curriculum through use of telemedicine communications. The second criterion of measurable objectives were developed to meet the American Association of Colleges of Nursing, Essentials of Master's Education in Nursing, specifically Essential 7, and the National Organization of Nurse Practitioner Faculty Core Competencies of Independent Practice, as listed here. The focus of this two-phase simulation was to provide a realistic consultation between two advanced practice nurses in different specialties, addressing a cultural and spiritual difficult situation involving a couple from a rural, underserved population. Providers would need to demonstrate knowledge of current evidence-based practice recommendations and the use of critical thinking to adapt treatment plans to align with cultural and religious beliefs. Creating unique objectives that met the guidelines was the next step in Criterion 2. These objectives clearly define what would be expected of each practitioner student, as well as the expected input from the patient. We are fortunate at Frostburg State University to have a dynamic performing arts program. Dr. Kelly Rock, the Nurse Practitioner Program Director, successfully recruited faculty from the theater department and instructional designers to assist us in this endeavor. Once again, all faculty attended seminars on healthcare theater and visited several successful healthcare theater programs to educate ourselves on the process of training standardized patients using theater students to meet our needs and ensure standardization and replication of the scenarios. The format for this scenario, which addresses the UNESCO Criterion 3, is based on the broad objectives and focuses on cultural and spiritual beliefs of this patient, interprofessional evidence-based guidelines, and identification and management of barriers to care. It is designed for implementation towards the end of the program, preparing the nurse practitioner students for independent practice, and will enhance the students' proficiency in computer-based telemedicine and hybrid simulation using standardized patients from the theater department. The two-step simulation will first involve the family nurse practitioner student performing an intake history and physical examination, creating documentation, arranging a telemedicine visit for consultation, and then actually performing the consultation. The design includes two-phase simulation. Both phases include comprehensive pre-briefing by faculty in their respective disciplines. Simulation 1 will only involve the family nurse practitioner student interacting with the theater students, but streamlined for class viewing and debriefing for this simulation will be limited to just students and faculty that are applicable for that phase. Phase 2 will involve the family nurse practitioner, the psych nurse practitioner, and the theater students performing a telemedicine consultation, and the design is pre-briefing with the independent discipline faculty performing that pre-briefing, implementation that is streamed for class viewing, and then large group debriefing. In an effort to create realistic simulation experiences, I based this scenario on a combination of actual cases that I experienced as a rural family nurse practitioner over the past 20 years. To improve realism, actual theater students were trained to portray the roles of the patient and the family, including dress and mannerisms. Consultation with actual psychiatric mental health nurse practitioner students is completed through the use of computer technology. Constance Wu is an Asian actress who states that listening to an underserved population is how you begin to understand them and serve them better. I firmly agree with that. One of the underlying purposes of this simulation is to hopefully facilitate listening skills and instill the importance of keeping the patient at the head of the treatment team and highlighting the impact of cultural and spiritual practices on providing evidence-based care. For the first simulation, the family nurse practitioner student will have a face-to-face appointment with the Amish female and her husband for an in-depth interview and physical examination. This is the first part in fulfilling Criterion 5 of realism. There will be dynamic interaction, and the theater students will be prepped to follow a script that is developed to be in alignment with cultural and religious beliefs and mannerisms that were specifically identified as barriers in the situation. The second simulation is the actual telemedicine consultation between the family practice and mental health nurse practitioners with the theater students present. This continues to provide realism to the simulation as the patient and her husband are now directly involved in discussion, decision-making, and formulation of a mutually acceptable treatment plan. The facilitators for the scenarios are the respective faculty, all of which have strived to obtain formal education with well over 100 hours of simulation experience that is specific to healthcare theater and healthcare simulation. Detailed independent and intercollaborative goals and objectives were identified in an effort to standardize the scenarios. Pre-briefing will be on campus and completed independently between the students and their respective faculty to ensure that the preparatory reading was completed and the student understands the objectives and goals. The student will demonstrate understanding of the scenario as well as the cultural beliefs, religious practices, and evidence-based guidelines appropriate for this specific simulation. Debriefing will be completed using the Debriefing for Meaningful Learning theory and will be completed as a group event including faculty from all disciplines as well as the theater students, family practice, and psychiatric mental health students. Evaluation of this two-phase scenario will include independent assessment of objectives, each simulation independently, and then an overall evaluation of the complete process. Preparation for the simulation will involve outside readings to assist students' understanding of the cultural diversity applicable to this scenario, as well as religious practices in the Amish community. Special attention will be placed on the cultural aversion to technology that I found to be the greatest barrier to care when I faced this actual situation in my clinical practice. The theater students will have some in-class instruction and evaluation to ensure that they are portraying appropriate speech and mannerisms that align with that culture. As indicated in the beginning of this presentation, this is a newly developed program and this actual simulation has not taken place yet. However, with the full support of other faculty and instructional designers, I anticipate a successful pilot test in the near future and plan to update this talk with the evaluation data. Our first cohort of students started this past Monday, so I anticipate this in the near future. Thank you for your time and attention, and I would especially like to thank the consortium for providing me with the knowledge to enable me to create this advanced practice simulation and supporting documentation. Thank you again.